Hey guys. So today's video, long-awaited video, much requested video is about everything you need to know about the ESMO examination. The European Society of Medical Oncology conducts an examination called the ESMO examination. And today I'm going to break down everything that you need to know about this examination and how to approach it and how to do well in this particular examination. So let's get right into it. So the number one question that needs to be answered is why should I write the ESMO exam, right? Um, so there are many reasons as to why this examination is good for you. So let's look at some of those reasons. For me personally, the biggest reason was I wrote the exam as a tool, right, to revise my course syllabus. So it essentially helped me revise the entire syllabus for my DM exam, right? And it can also evaluate where you stand prior to your final university exam. So that it is a tool to, you can use it as a outlet to revise for your final university exam for your DM or DRNB course. So that's why it's good to give it. Now you can also evaluate where you stand, from knowledge point of view with your peers from around the world. So it's written by people from all countries around the world, from South America to Europe to Africa to Asia. So it'll give you a percentile as to where you stand amongst your peers. So it's a good way to evaluate where you stand. Now, of course, another reason is it's an added feather in your cap. The ESMO exam is recognized worldwide over, and it shows that you have a certain standard when it comes to medical oncology that you have attained by passing this exam. Now, the next reason is it's an easy exam. It's something that anyone, I feel that any Indian who's studying medical oncology can easily pass. I'll get into the reasons for that. And it's fairly straightforward. Unlike some other exams, such as your MRCPSCE, it's a straightforward exam. And if you know what you need to study, it can easily be passed. And the most important reason, we are living on a regulated budget. So it's a relatively cheap exam, especially if you apply for the early bird offer. It can be given for, not a lot of money is involved here. So it's a relatively cheap exam to give. So you can, even do it during your residency, when you're, running low on funds. So these are reasons why you need to give the exam. It's a revision for your final university exams. You can compare and contrast where you stand amongst your peers from around the world. It's an added degree or feather in your cap. It's easy and straightforward, and most importantly, it's cheap to give. Now, a lot of people have messaged me saying, when should I give my ESMO exams? Even some first years who have newly joined medical oncology have asked me, when should I give my exam? So let's look at the pros and cons of when you should give your exam and, like the associated pros and cons. So if you've just joined your medical oncology course in your first year, right, it might be difficult for you depending on your background. So if you're from a radiation oncology background, you already have locked in the fundamentals of oncology, right? Of course, this is my opinion. You know, some of you might have a differing opinion, but if you're from an RO background, you've already locked in your concepts about your basic oncology. So, and you might have been exposed, depending on the institute where you practiced, you might have been exposed to chemotherapy and systemic therapies, right? So you might already have an idea. So if you have such an idea, I know many people with an RO background who have passed in the first year itself, or even prior to taking their medical oncology course. So it can be done. You can pass it, but scoring high will be difficult, because there are still many concepts that you have to pick up, that you'll only pick up once you have gone through your medical oncology residency. So it's definitely possible to attain a pass, but it's going to be slightly tricky. And not just that, to score high, it's going to be difficult. Now, from the second year, so it depends. The second year, it depends, it depends on how much you've prepared so far in your course. So if you've been studying along from day one, or, if you have done a fair bit of studying and you're fairly confident, then regardless of your background, you can achieve a pass. Once again, you're not fully fledged in your knowledge, so it might be difficult to score high. If your goal is to score high and not just pass, that might be difficult, but you definitely can pass in the second year. Now, the third year is ideally, in my opinion, the best time to give your exam. And the reason for that is very simple. The reason is because that's when you've started, really preparing for your university exams. That's when your knowledge is at an all-time peak, right? And so you'll be well prepared to write the ESMO exam. Not just that, you'll be well versed enough to score highly. Okay. And if that's your goal, I think third year is the optimal year to give your ESMO exam, because that's when your knowledge will be at a peak and you'll perform your best. Now, the next thing is, okay, I've broken down based on your year, when to give the ESMO exam, but how do you decide? Suppose you're not really sure, right? Okay, do I know enough to really pass this exam? Should I waste all my money by traveling and the exam fees and all that? Should I do it right now or do it later? So you can test your level, so to speak, by logging onto this website using this link. And over there, if you scroll down to the bottom of that page, there'll be an option of testing yourself with a trial exam. Okay. So that'll be a trial exam where you can test yourself, where you can look at the level of the questions, right? And get an idea as to where you stand and whether you're in a good enough position to give the exam in your current state. Okay, so that's a way to test yourself, to test your confidence levels. And that can also help you in deciding whether you're ready to take the exam right now. So that's an important tool to test whether you can take the exam. Now, the format is something that you should know. So it consists of 100 multiple choice questions. It's an MCQ based exam, right? It lasts for 150 minutes. And the important thing to note here is that there is no negative marking whatsoever. So don't leave a question unattended. You should attend all the questions. There is no negative marking, right? Now, I won't tell you about how to solve MCQs. I think we are all well versed in that. That's how we got to where we are right now. But the exam has two types of questions. So you have 75 type A questions and 25 type K questions. Now let us look at what these type A and type K questions are. So type A questions has a single answer, right? They have 75 of them. And so it's like your typical MCQ, right? You mark a single answer and that's about it. It's pretty straightforward. Now you have 25 type K questions as well. And these have multiple right answers, okay? So usually they'll make a statement or a case summary and you'll be asked various components regarding that particular case or that particular scenario. And you have to mark whether each component is true or false, okay? So I'll give you examples for both type A and type K, right? So this is a type A question. So a 30-year-old man presents with increasing weakness of the right arm over the last 4 weeks. An MRI of the brain shows a 2 centimeter contrast enhancing mass in the left parietal lobe with edema. A surgical biopsy reveals that it's a glioblastoma. And his ECOG performance is good and he has no comorbidity. So what is not part of the management, right? So of course, temozolomide, we know the Stoop protocol. You need to do complete tumor excision, maximal safe resection, that's part of the treatment, followed by adjuvant CTRT, so radiation is part of it. The concurrent chemotherapy agent you give is temozolomide, so that is also part of it, right? And you also give adjuvant temozolomide. Of course, you need to manage with steroids because there'll be, since it's a glioblastoma, there'll be a lot of peritumoral edema, which can cause symptoms. So steroids will also play a part in the management. But of course, anti-epileptic prophylaxis is not given in all patients. It is not recommended to give it upfront. You only give it if the patient has a history of seizures. So that is the right answer. You would mark anti-epileptic prophylaxis. It's only a single answer. So that's example of a type A question. There's only a single answer. Now, let's look at a type K question. So a type K question is, there'll be multiple subparts to that question, and you need to mark whether each subpart is true or false. So this is a very relevant question. Example of a type K question. In a case of creat clearance less than 30 ml per minute, which agent requires dose modification, right? So of course we know that bleomycin and capecitabine has a dose modification based on creat clearance. So that's the right answer. So it's true for bleomycin and true for capecitabine. But there's no dose reduction based on creat clearance for doxorubicin or vincristine. So you'd mark that as false. So that is an example of a type K question, right? It's made up of different components and you have to mark whether each component is true or false. Always be sure to read the question, right? This goes for any MCQ exam, whether it's you're talking, look at keywords such as except or all of the above, etc., right? So that you don't mess up on an easy question. So I hope you understood the format. 100 questions, 150 minutes, no negative marking, consists of 75 type A questions with single answers and 25 type K questions with multiple answers. Now, let's look at the upcoming ESMO exam. We have an exam coming up on Saturday, 24th October 2026, right? It's held only in a single center in India, that is in Chennai, right? They will give you all the center details. Usually it's held in the Savatha Medical College on the outskirts of the Chennai city. So you might have to make travel arrangements, hotel bookings, etc. and this is the date it's being held. I think the early bird offer is running out, so you might have to, you might not be able to avail that, right? But you can register for the exam with the following link that I put below on the bottom of the slide. That is the link to register for this exam. Now, the most important question is, how do I prepare for the ESMO exam? What are the tools and areas that I need to focus on to do well on my ESMO exam? Let us quickly look at that. So the questions are pretty straightforward clinical scenarios and questions, right? So you have a bunch of straightforward questions that focus on clinical scenarios and, maybe even, just straightforward questions, single line questions. So what sort of questions do you get? So we have questions regarding the line of management. For example, if it's the first line management of, say, CS cervix, right? You would think of a platinum plus paclitaxel plus pembrolizumab, the CPS score is greater than 1. So they might give you a scenario, advanced CS cervix with CPS score of greater than 1. What is your optimal treatment? So you'll go for platinum, paclitaxel plus pembrolizumab, plus or minus bevacizumab, right? So that is the right answer. Or you might get another question. For example, uh, the patient is a case of advanced CA colon that is unresectable, right? Their RAS-RAF is mutated. So what is the first line management? So there you'll go for FOLFOX plus bevacizumab because you cannot give EGFR monoclonal antibody inhibitors, right? So fairly straightforward questions regarding the line of management is common. So you just need to be aware of the line, the first line management for various scenarios, right? Sometimes they will ask you directly. Sometimes they might put a scenario like RAS is mutated, right? Or BRAF is mutated, right? So it depends. So they're fairly simple, straightforward questions regarding the line of management. Then another type of questioning they ask is toxicity management, right? So they'll might ask about a particular toxicity and what you do in that scenario. For example, if the patient has grade 3 hand-foot syndrome, what would you do? So in that scenario, you would obviously, stop the drug, withhold the drug, and then once the hand-foot syndrome has resolved to grade 1 or less, then you would continue the drug with the dose reduction, right? For example. So these are sort of questions that they tend to ask. For example, if you have grade 3 pneumonitis on immune checkpoint inhibitors, then you would permanently withhold the drug and give high-dose steroids, right? Or if you have cytokine release syndrome, for example, then you might have to add tocilizumab. And if it does not work, you might have to go to steroids, right? So those are sort of questions they ask regarding toxicity of the very commonly used chemotherapy as well as targeted therapies and immune checkpoint inhibitors. So that's another line of questioning. Then you have drugs, right? So a lot of questions about drugs are asked. They could be about classical chemotherapy drugs, like we saw in that previous example of, question K, type K question that I gave you of create clearance. So just like that, they can ask you about classical chemotherapy drugs, and they can ask you about the new drugs, such as ADCs. So they can ask you this particular ADC. For example, your trastuzumab deruxtecan, for example. What is the payload? So what type of chemotherapy is the payload? Then you have to say it's a topoisomerase inhibitor, for example, right? Or you can ask you about brentuximab vedotin. What is the payload for vedotin? Or they can ask you about the target of that particular antibody drug conjugate, for example. Or if it's a bispecific antibody, they can ask you about the targets for that bispecific antibody. For example, if you have tarlatamab, for example, which is given in small cell lung cancer, the two targets are CD3 and DLL, right? So questions like that can be asked about classical chemotherapy agents, but also about targeted therapies and new molecules such as ADCs, bispecifics, ICIs, etc. So that can also be asked. Then important oncology trials. They can ask you, very basic questions about landmark trials, right? So I'll talk about that later on, like landmark trials, recent trials such as Destiny Breast 9 or Breakwater trial, etc. So they can ask you very easy, straightforward questions about that. And of course, supportive care, your basic supportive care questions are, very commonly asked about that. So these are the types of questions that are asked. Now let us look at the weightage, right? This is from the previous exam in 2025. As you can see here, and in previous years as well, more than half of the questions are from chest malignancies, mainly lung cancer, right? Breast cancer, super important. And of course, you have your GI malignancies, super important. Your GU malignancies, which are also super important. So those cancers make up a bulk of the questions. And if you know those cancers inside out, then you'll automatically pass the exam. It is a given, right? Because you'll be able to solve most of the remaining questions as well, a few of the remaining questions as well. So that'll get you over the pass mark, right? Which is considered to be around 55 to 60% of the questions. Okay. So that is where the pass mark lies. It's a percentile base. It's based on the percentile and the performance of the people, other people around the world, right? The pass mark that they set each year. So these are the weightage of the topics, and these are the important topics: chest, breast cancer, GU, and GI. They make up the bulk of the questions, and if you're well focused on those areas, you'll do well to pass. Now, before we get into the tools to do well in your exam, the first thing you need to do, even to register for the exam, is to become an ESMO member, right? So they will, this is the link for to get the membership. It is completely free for lower middle income countries such as ours, and they do have a processing time of around 7 to 10 days. So you need to wait for that. You might have to give some evidence of your current employment or your residency, etc. Right? And they'll verify that. They'll get back to you in 7 to 10 days with your membership. It's as simple as that, and it's free of cost. So the most important targeted tool for your ESMO exam is the ESMO guidelines. Now, for each site, ESMO has come out with a PDF or a article, with guidelines as to how to manage them. And within these guidelines, the flow charts are super important. They're easy to study and they're easy to retain, and they're super high yield, okay? Because they ask a lot of questions directly from the flow charts. So if you're able to read the flow charts, at least the flow charts for all the ESMO guidelines on each topic, right? And just go through the flow charts, get an idea of where each regimen goes and when you give it, then you will do well because they directly pull a lot of questions from these flowcharts. Okay. And they can be accessed for free once you're an ESMO member from the ESMO website. You just need to Google it. So for example, C endometrium ESMO guidelines, right? You'll get the flowcharts, the guidelines free of cost, which includes the flowcharts as well. So go through the flowcharts, look at what treatment, where to give it, right? And that will give you a lot of questions that can be asked for your ESMO exams. For example, I'll ask you, I'll just go to a question that they asked in one of the ESMO exams. So they asked, in a case of thymoma, right? And this is a case of stage 3 that underwent arterial resection, what sort of treatment do you need to give? So they gave adjuvant chemotherapy, adjuvant CTRT, adjuvant RT, no further adjuvant treatment. So you can see here that for a patient of thymoma who has undergone arterial resection, who's stage 3, you need to give adjuvant radiation, right? So it's as simple as that. If you have gone through the flow charts and if you have an idea, you can answer a lot of the questions. Even some of the so-called tougher questions can be easily answered if you've gone through the flow charts. Now, regarding the guidelines, you need to be aware of one thing, that a lot of the ESMO guidelines have been updated recently, especially in the last 2 years. Okay. So many questions can be expected from these updated guidelines. Okay. So, for example, if you look at C endometrium, right? The previous guidelines were updated around 5, 6 years back. But currently, we have an update in 2025 with certain modifications based on the molecular subtypes, right? So you need to go through the updated guidelines. So make sure that whatever guidelines you're going through, some of them have not been updated. So you can stick to the older ones, but the ones that have been updated, you need to go through the updated guidelines. So make sure that you're looking at the most recent guidelines, ESMO guidelines for that particular topic, right? So that is another important point that you need to note down. We go through the updated guidelines because for certain topics, they have updated the guidelines because those will be high yield for your ESMO exams, right? So this is another updated guidance, for example, for CA bladder. Now we know that the treatment of choice, whenever available or logistically feasible, is enfortumab vedotin plus pembrolizumab, right? And we have the other options apart from that as well. So that's given in the updated guidelines for CA bladder, not in the older one. Now, another important tool for your ESMO exams is the ESMO Academy. So the European Society of Medical Oncology holds an annual academy for 2 to 3 days where they have experts coming in and giving presentations on the important topics in medical oncology. So if you just go through the slides or the videos for that, for example, the last ESMO Academy, which is held in 2025, you will get a lot of high-yield questions and high-yield points that will be directly asked in your ESMO exams. In fact, a lot of the toppers have repeatedly said that the ESMO Academy content has really helped them perform well in their ESMO exams. So super important is the ESMO Academy. I've given the link over here. You can access the previous year's content. Of course, you need to be an ESMO member, which is why I mentioned that in the beginning. Get into the ESMO membership so you can access all this super important high-yield content. ESMO Academy meetings, slides, and videos. Definitely do check it out if you have time. Now, Another high yield component to this exam is the new drugs. Like I mentioned earlier, I alluded to it earlier, is antibody drug conjugates, bispecific antibodies, CAR T cell therapy, including the toxicity management, right? And of course, targeted therapies in, for example, CA lung, breast, melanoma, GI. All of this is super important. And they repeatedly ask very direct, very simple questions regarding these new drugs. That if you just skim through these new drugs, right, the basic mechanism of action, the targets, the toxicities, etc., you'll that's enough to answer those questions. They're very straightforward questions. Either you know them or you don't. So it's important to invest your time in learning about these new drugs. For example, on antibody drug conjugates, I've put out a video on YouTube. It's very exhaustive video. If you just cover that, you'll get 5, 6 questions on that for your ESMO exam, right? Similarly, just for bispecific antibodies in CART and target therapy in CA lung, you need to do your own study, right? I'll put out videos for that as well on my drug oncology channel, right? So look out for that. I'll just give an example. For example, I mean, ADCs, bispecifics, and CAR-T, it's pretty straightforward what they can ask you. But targeted therapy in lung is also commonly asked. For example, they can ask you, a patient is got advanced non-small cell lung cancer and they've got a ROS1 mutation. What is your treatment of choice? So they can put the options can be crizotinib, it can be entrectinib, right? It can be lorlatinib. They can also put talotrectinib. So a treatment of choice here is talotrectinib, because we know that talotrectinib and repotrectinib are the latest and the most efficacious drugs for ROS1 metastatic non-small cell lung cancer, right? So those are the type of questions they can ask you. Very straightforward questions, nothing out of the ordinary. Or they can ask you, what is the treatment of choice for example, exon 20 insertion mutated advanced non-small cell lung cancer. So the treatment of choice there is chemotherapy plus amivantamab based on the Papillon trial. So very straightforward questions. That's what they tend to ask. If you've gone through these topics, you will do very well. And in fact, you'll score higher, right? Because not everyone goes through these topics. New oncology trials are also, very commonly asked. They ask very simple questions regarding, these trials, right? They usually focus on the regimens, the indications where you give these regimens, and the common toxicities or the outcomes, right? So there are a few trials that I've just jotted down here. For example, in breast, you have Destiny Breast 9 for, your first line TDXT, Destiny Breast 5 for adjuvant TDXT in HER2 positive early breast cancer. You've got the ASCENT 3 and 4 and the Tropion Breast 2 trials, which are regarding the management of first line metastatic triple negative breast cancer, right, with ADCs. Head and neck, you've got, of course, Keynote 689, Nivo post-op trials. GU, you've got EV 303 and 304 regarding EV plus pembro and platinum eligible and platinum ineligible muscle invasive bladder cancer. You've got the Amplitude trial for PARP inhibitors in metastatic hormone sensitive prostate cancer. In GI, you've got the Atomic trial for DMMR, where you give adjuvant atezolizumab with chemotherapy, Matterhorn trial, Checkmate 9DW, Checkmate 8HW, right, which is about giving Nivo plus IPI in DMMR metastatic colon cancer, Niche 2 trial, which is about neoadjuvant immunotherapy in DMMR colon cancer, right? So all these trials are very recent, very path-breaking, very landmark, pretty much landmark trials that you need to be well versed with. So study the indications, study the treatment arms, study the toxicities and the outcomes, and you'll score even higher in your ESMO exams, right? Even lung cancer, Flora 2, Mariposa 1 and 2, Papillon trials, all very recent landmark trials. So be well versed with the landmark trials. Just need to study the indication, the treatment arms, the doses, the outcomes, what was significantly better with the new treatment, and of course, the common toxicities, right, that were observed. So that's all you need to know regarding the new oncology trials. You study that, you'll do even better in your ESMO exam. And of course, another area that gets commonly asked, and that's something that we need to know as medical oncologists, is regarding supportive care, right? So these are very straightforward questions based on scenarios you would have encountered on a daily basis in your wards or clinics, right? So, tumor lysis syndrome, mucositis, spinal cord compression, nausea and vomiting, immunotherapy toxicities, pain management, etc. So these are, pretty commonly encountered scenarios. Some of you might be very confident regarding this. You need not study it in particular for the exam. If you want to do better and if you want to be very, sort of OCD about it, you can check out this link. So you have the ESMO clinical practice guidelines for supportive and palliative care. And you can just go through that, quickly run through that to consolidate the knowledge you already have, that you have already gained through your clinics, right? So that is also very high yield, and that's something that you can focus on. And I've given you the link to get the content to study that material, if at all you need to brush up your supportive care knowledge. Now, This is something that I saved for last because in India, we have a very exhaustive theoretical exam, at the end of your DM course or DRNB course, especially your DRNB course. The questions and the syllabus that you cover for these courses are very vast, very exhaustive. And that alone, in my opinion, is enough to help you pass the ESMO exam. If you've studied very well, especially if you're in your final year or if you've just completed your course, if you are well versed with the theory knowledge in these exams, in your university exams, right? That is enough to at least pass your ESMO exams. If not do really well, at least pass the ESMO exams, right? So if you can consolidate the knowledge that you have from your DM or DRNB preparation for the university exams with the added points, with the ESMO content, right? The guidelines, the flow charts, the academy content, and the supportive care, the new drugs, and the new trials. If you consolidate all of that, you will not only pass, you will do extremely well. Maybe get into the top five, right? So that is a possibility. It is not far from your reach. It can easily be done. Um, and you need to go ahead into that exam, especially if you're in final year or if you've completed your DM or DRNB. You need to go into the ESMO exam with the confidence that the syllabus that you've covered for your university exam is more than enough to pass. You can go ahead with that confidence. I can assure you of that. Okay. So that is the confidence, and that is the sort of cushion that we have in India, is that our exams are very exhaustive and very thorough regarding how they test our knowledge. So that is enough to pass the ESMO exam. Let me repeat that again. Now, let me, on a lighter note, let me just give you a very honest uh, look at my ESMO experience. So I wrote my exam in final year, right? I think around 6 or 7 months before my university exam. I thought of, okay, let me see where I stand. Let me see how much damage I can do by writing this exam. So I just thought, let's have fun with it. And also a lot of my seniors and also junior from my MD course, they were also there to write the exam. So I thought, let's all get together. Let's have a good time, meet up, catch up with each other, and also, on the side, let's write the exam. So that was sort of my approach with this exam. I sort of had a laid back approach, to be very honest. And you need not worry. Don't get tensed about it. This is something that you're adding on to, your ultimate goal, which is your super specialty degree, right? Which you've already got or you're working for. So just go into the exam with a laid back attitude, not too laid back, as I'll explain later on. So these are, my friends, seniors and junior that I went with, and we had a great time. We got there a day earlier, and we enjoyed, caught up with each other. So the mistake we made was we booked a hotel sort of 2.5 hours away from the exam center. Don't make that mistake. Chennai is a big city. The exam center is on the outskirts. So look at the map, look at where the exam center is. Usually it's Savata Medical College. It's a private medical college and hospital. So book a hotel next to the center so that you can get there easily and without much hassle. Okay. Now, the next thing to do is, next mistake we made is that we did not book a cab prior. So right before, getting to the exam, we were running around trying to get a cab because, we are not able to get a cab at that point in time. So we had to run out on the street and basically plead with each taxi driver to get us there. Because also we booked the hotel far away, so we had to travel 2 hours. So no one was willing to go. So book a cab in advance so that you don't have to go through that hassle. Okay. So you can do it on Uber. You can just book a cab in advance. You can specify the timing and they'll come and pick you up, right? At that particular time. So book it in advance. Now, the third point that's sort of funny is that, we were getting back together after a long time. So, of course, we had a few drinks. We enjoyed a little bit too much. And we were sort of in an inebriated condition when we got to that exam. So don't make that mistake. If you're meeting your friends, if you're meeting, your old friends from your MD course, don't get too excited. Save the fireworks and the partying for after the exam. Maybe take a day off after the exam and then enjoy. Don't enjoy before the exam or right before the exam. Okay, so that you can be focused. You can sort of give the exam to the best of your abilities. So that's a sort of a mistake. I don't regret it that much, but it is a mistake that we made that I would not advise you guys to make. So those are some experiences for me given that exam, and things that you should avoid doing. Some of them are very obvious, but yeah. So what is the end result? End result is you'll get a certificate like this on passing the exam. The results usually come within 1.5 months, and they'll give us online certificate like this, which you can, frame it up and put in your OPD and sort of say, I've written the ESMO exam, right? The quality of your knowledge is up there with people from around the world. So it's definitely a proud thing. Now, there's one more thing. If you're not just okay with passing the exam, another thing that you can do is try to get into the top five, or maybe even be the worldwide topper, right? So, for the more ambitious out of the people out there, if you follow the exact guidelines that I've told you, right, you can even get into the top five. That is not too far a goal. That's something that is well within your reach, especially if you're confident, you can do it. The questions are easy, right? And if you follow the tools that I mentioned, you can get into the top five worldwide. Now, I did mention that I attended the exam in inebriated state. I don't know if that's what helped me. I won't endorse that behavior. Or maybe I could have done better if I was not. But at the end of the day, I ended up getting into the top five. So I got an email like this: top five performers of the ESMO examination from around the world. And your name will be featured on the ESMO website, right? So there were a couple of Indians, me included, that were featured in that particular year. So it is very possible if you follow the guidelines. Passing, you can definitely do it. Attend the exam without any fear. If you want to get into the top five, strictly follow the guidelines that I've given you. That will help you get into the top five. And it is an easy exam to give, straightforward questions. There is nothing that should be holding you back from giving the ESMO examination. Please do it. I hope you understood how to, regarding the examination pattern, the tools to prepare for the examination, and the do's and don'ts on the day of the examination. Thank you very much. Hope this was a helpful video. Thank you very much.